infections, friend or foe in autoimmunity? I asked the question in our drugless support for autoimmunity group, if a doctor finds H. pylori, which is a bacterial infection in the stomach, it's been known to cause ulcers and lead to increased risk of gastric cancer and more. But if a doctor finds H. pylori in an autoimmune patient, should they treat it? And the choices were yes, no, or it depends. Yes is right often, but no is right sometimes. And so the best answer is it depends. Because the research is really both ways. And it shows that infections, H. pylori and other infections, cause autoimmunity or activate pre-existing autoimmunity. But it also shows that in some cases, infections protect against autoimmunity and help it from not activating. And so sometimes the infection is commensal, meaning it's just there as part of the normal flora and it's not a big deal and it probably shouldn't be treated. Even the doc that discovered H. pylori, I meant to grab his book before I did this video, but he even says that sometimes it's commensal, it doesn't need to be treated. Now most of the time it does. And I've had it in the past myself, and it definitely helped get rid of some symptoms when I had it treated. And somebody in our group said that, yeah, I had it, and I've got celiac disease, but I also found out I had H. pylori, and when it got treated, I improved more yet. I don't doubt it. But the research shows that in some cases it's protective against or helping autoimmunity, particularly in conditions like MS. Certain of these infections, H. pylori and other infections, may be protective. It's interesting that MS is so much more of it in the United States and in Europe, but if you go to African countries where there's a lot of traveler's diarrhea and a lot of gut infections, it's almost non-existent. And so there are different papers that discuss this. One's called Infections and Autoimmunity, Friend or Foe. Another one's Infections, a Double-Edged Sword in Autoimmunity. And I thought about bringing out the papers, and I thought, well, you're all going to either believe me, or if you don't believe me, you can use Google and look it all up yourself. But for conditions like rheumatoid arthritis, there are some papers that show that it induces rheumatoid arthritis, example of H. pylori, and some papers show that H. pylori is protective in rheumatoid arthritis. The same goes for lupus. Some papers show that it induces lupus, some papers show that it's protective against lupus. For autoimmune gastritis, some papers show that it induces it, and it would make sense that it might, H. pylori, but other papers show that it's protective for H. pylori, for autoimmune gastritis. And so there's no right answer, but the for sure answer is that when we are autoimmune, the normal rules don't apply. So the normal rules would say, yeah, treat it because there's a lot of potential benefit in getting it treated. You're going to absorb nutrients better, and you're going to have less inflammation, and you're going to have less risk for gastric cancer, and you're less likely to develop an ulcer, and you're just going to digest your food better. It's going to reduce inflammation throughout the body. And all that stuff is true in most cases and for the non-autoimmune patient. But again, for the autoimmune patient, the rules are out the window. And so the best answer is for H. pylori and many other infections is maybe, or it depends. And it could depend on several things. One, it could depend on, if there's really strong research, for example, MS, and that it's protective, well, maybe you don't treat it. But if a person is feeling horrible and they have a lot of gastric symptoms and they're like, I couldn't feel any worse if you treat this, well, yeah, treat it. But if they're like have made amazing progress and all of a sudden they're in remission, and then you find H. pylori on a stool test, you might want to just leave it alone, because if they're already in remission, you might mess them up in treating it. And I've heard of doctors where that's happened for patients that they treated it. So that's the long answer to the short question. It depends if it should be treated or not. So that's what's really interesting about autoimmunity, is that the normal rules don't really apply, and we have to go think a bit out of the box. And in our office, one of the things we do is let the brain tell us what the primary antigen or primary bad guy is. And if I see, like recently I ran a stool test first on a person that just was having long-standing GI symptoms. They thought they had a lot of yeast, etc. I said, well, let's take a look with a stool test and see. So we ran the stool test. They had H. pylori. Then when I went to our QNRT exam, our brain exam, it also showed the reflex points for H. pylori was the main thing to work with. So obviously we worked with that person on H. pylori, and with them we're going to use series therapy, which is a homeopathic series of dilutions that change 10 times, 10 steps up and 10 steps down, to deeply clear these infections and build resistance, but more importantly calm down the autoimmune response. But in other patients, if I had ran that stool test and I see H. pylori, but their main issue seems to be mercury by all other indicators, we might leave the H. pylori alone, at least at first. And so we're going to let the brain tell us where we need to work. So that's the amazing advantage that we have with this QNRT system that we use. So if you want more information, look up some of those papers about autoimmunity, friend or foe, things like that, and really dive into it. But most of us just need to know that the normal rules don't apply in autoimmunity, and so you got to think about every decision you make and every step you take if you're autoimmune. So I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined. We'd love to have you in our Facebook group, Drugless Support for Autoimmunity. Just search it directly or go to Winters Wellness Center on Facebook and click groups, and you'll see it there and ask to join. And as always, subscribe to us here on YouTube. Our subscribers are growing, and we look forward to providing you more information. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined.